Did you know that on average Americans spend nearly $14,570 per year on healthcare? This makes you ask the question, should healthcare be free? Can I get a show of hands of who's been to the hospital before? Me too. In many countries other than the US, healthcare is free. My name is Luke Forgas, and I've been researching the pros and cons of universal healthcare. Implementing free healthcare presents several challenges and advantages I'd like to talk about. I'd like to start with the pros. Andrew Walter, who wrote Universal Healthcare Overview, states, universal healthcare is a term that describes any system in which all residents of a country have guaranteed access to healthcare. With free healthcare, there'd be an increased inequality because everybody would have an equal opportunity to the same medical services, regardless of their income. There'd be improved public health because everybody could go to the hospital without having to worry about the money, and a healthier population would have a longer life expectancy. There'd also be no medical debt. The average visit to an ER in the United States costs $2,500. This is very expensive and could put many people in debt. With free healthcare, people would not have to worry about the high cost of healthcare putting them into debt. Next, I'd like to talk about the cons. There'd be increased taxes. Universal healthcare would significantly increase the taxes. Some people say this puts the burden into paying for healthcare into the taxes instead of medical bills, which makes it pointless. There'd also be longer wait times because all the hospitals would have a rise in demand from people taking advantage of the new system. This could be seen as a good thing, but it also leaves people who need healthcare more waiting for healthcare longer. You'd also wouldn't have a choice in who your doctor is and how you're treated because it's all government funded. The middle ground would be a system that would cover essential medical services like routine checkups, but wouldn't do specialized care. Many countries such as Germany and Australia and Netherlands already use a very similar system to this. In conclusion, the pros of universal healthcare are increased equality, improved public health, and no medical debt. The cons of universal healthcare are increased taxes, longer wait times, and limited choices. On average, Americans spend $14,570 per year on healthcare. I brought this up because it just shows how expensive healthcare in America is. Thank you for your time.